Alright, so a lot of these were on the midterm. So you have the clavotrapezius, which they didn't really clear, right? Clavotrapezius on the back of the neck.
Can you get it now?
Then you have the acromiotrapezius, which is sort of oval shape. It's the same, right, as the scapular. The scapular is oval in the cat. Then on the upper back, you have the spinotrapezius, which is sort of arrow or triangular shape. So you go clavotrapezius, superficial muscle on the back. Acromiotrapezius, superficial on the scapular. Spinotrapezius, superficial on the upper back. Covering the side of the back, we have the latissimus dorsi, which is a very large muscle. Then on the shoulder, we have the three deltoid muscles. The flap here is called the clavodeltoid, also called the clavobrachialis on your sheet. Then you have the triangular muscle here, which is the acromiodeltoid. And then the sort of oval-shaped muscle here on the side of the shoulder is the spinodeltoid. So you have clavodeltoid, acromiodeltoid, spinodeltoid. The diagonal band-like muscle between the acromiodeltoid and the acromiotrapezius. This band here is the levator scapulae ventralis. Okay, so those are the superficial muscles. Again, CAS, clavotrapezius, acromiotrapezius, spinotrapezius. Clavodeltoid, acromiodeltoid, spinodeltoid, CAS. Then you have the latissimus dorsi on the side of the back, and the levator scapulae ventralis between the acromiodeltoid and the acromiotrapezius.
Cool.
Deep back muscles.
Okay.
Deep back muscles. Here we go.
Okay, so this is the rhomboideus capitis, if you remember, the long band that goes from the scapula to the back of the head. We have the rhomboideus muscles, which look like rubber bands, right, connecting the spine to the scapular. So you don't have to distinguish like rhomboideus major or minor. You just have to write rhomboideus if I put a pin in this area.
Rhomboideus.
With the band that goes to the head, you have to write rhomboideus capitis. Right, then on the scapular, right, this is the spine of the scapula, the blade, shoulder blade. Above the spine of the scapula, you have the supraspinatus. Below the spine, you have the infraspinatus, because it's inferior below the spine.
So where is the spine? How do you identify it?
Well, you could feel it here. It's a raised area. It's the shoulder blade.
It's like, it's like a little glossier, like the whiter
if you
part.
could feel it's raised, that's where the shoulder blade is, the spine of the scapula.
Okay.
So above is the supraspinatus, superior to the spine. Below the spine is the infraspinatus. And on the lower border of the scapula, this muscle here is called the teres major.
Teres major. How do you spell that?
T-R-S, and then teres major, major. Okay, the muscle on the underside of the scapula here, right, is called the subscapularis, because it's on the underside, the very bottom of the scapula.
Like subcutaneous means like underneath.
Below, like subway, like sub is below. So these three muscles here, the supraspinatus, the infraspinatus, and the subscapularis, are all part of the rotator cuff, right?
Got it.
The fourth one is the teres minor, but you don't have to know the teres minor. It's been crossed out.
Okay.
And those are and the deep muscle of the neck here, right, on the neck, the deep muscle is called the splenius.
Splenius has nothing to do with the spleen.
No, splenium means bandage in Greek, so it wraps around the neck like a bandage, so it's called the splenius.
A splenia, you said, means a band?
Yeah, splenium means bandage in Greek. Okay, so it's the deep muscle of the neck is called the splenius.
So it's like, it's behind the...
Well, it's under the clavotrapezius,
okay.
But in this cat, they didn't clear the neck. Like there's still skin on the neck. They didn't do a good job on that part.
That's okay.
These are the muscles, the back muscles.
Okay.
Okay, so you have these two flaps here are called the serratus dorsalis. Alright, so this muscle here is called the serratus dorsalis. It has an upper region and a lower region. You don't have to distinguish. Just the whole thing, serratus dorsalis. And then you have the deep muscles of the back. Under the spinotrapezius, okay, you have the spinalis dorsi, this muscle here on the upper back.
Wait, can you point to that again? Where is it? Oh, right there?
Yeah, it's a sort of triangular shape.
Okay.
And then on the lower back, you could see clearly the longissimus dorsi, which If you remember, it looks like it splits into 3, but it's one muscle. Okay, so
Oh, I do remember that.
right, so don't confuse the longissimus dorsi, which runs down the long of the back, with the latissimus dorsi, which is on the side of the back.
Right, latissimus is on the side, longissimus
Runs down
is-
the length of the back.
So where does it begin? The longissimus.
Comes here, and then it continues actually.
Oh, so it begins here and then it goes.
But I would ask you it in the lumbar region, the lower
Okay.
back.
Got it.
Okay, then under the flaps of the serratus dorsalis, this third column is called the iliocostalis. So remember the slim, we have the spinalis dorsi, the longissimus dorsi, and the iliocostalis. So S-L-I, and then the
SLI.
muscle right on the spine here is called the multifidus spinae. Right, so it's the muscle medial to the longissimus dorsi, right on the spine.
Slim.
Slim, right? So we have spinalis dorsi, longissimus dorsi, L, iliocostalis, because costal means ribs, you can feel the ribs here, and then the multifidus spinae. So S-L-I-M.
Wait, what is this? This part is the continuation
Yeah.
of the longissimus dorsi. Okay, fine. So
here.
this muscle is like basically below the longissimus.
Yeah, so you have the spinalis column,
It's above it.
longissimus column, the iliocostalis
Okay, got it.
column, and the multifidus column.
Got it.
Okay, so those are the deep back muscles. Muscles, the pectoral muscles. Right, there are 4 pectoral muscles. All right, it's not that clear. I would probably put pins on each of them, like so you can see. Going straight across here, you have the pecto antebrachialis. Trying to see the boundaries. Then you have the pectoralis major, which is like from here to here. Then you have the pectoralis minor, which is bigger than the pectoralis major in the cat. And then the 4th strip, which comes off the xiphoid process, is called the xiphiomoralis. All right, so you have the pecto antebrachialis, pectoralis major, pectoralis minor from here to here, and then the 4th strip, the furthest down, is called the xiphiomoralis. And like I said, most likely on the practical, I would put pins in all 4 and ask you like 2 of them, because it's hard to see the boundaries. The deep thoracic muscles.
Wait.
Okay.
My video. Okay.
All right.
Okay, now it's gone. Sorry.
Okay, all right, I'm going to have to turn them around to see that. All right, so the pectoral muscles, we lifted them up like this. And when you do, you can see the fan shape. This is called the serratus ventralis. Remember, it looks like a fan or a seashell. It has like slats. All right, so this is called the serratus ventralis. Then if you remember, here's the rectus abdominis, which we're going to talk about in a minute. Runs straight up and down the abdomen. All of a sudden it crosses over here. Where it crosses over, this is called the transversus costarum, the one I call the exit ramp. All right, remember the exit ramp?
Oh yeah.
And then we have, it's not very good on this cat, but we had the arrows, the scalenus muscles. The middle part of the arrow is called the scalenus medius. Where I really got frayed, it's like this here. The arrow on the stomach side is called the scalenus anterior. And then the bottom part of the arrow here is called the scalenus posterior. And where the 3 of them merge, 1, 2, 3, you get like an arrow formation. All right, it was good on this cat, but it dried out a little.
Yeah.
So that's why I wrote no all 3 or all 3. So the big one in the middle, scalenus medius. The part of the arrow on the belly side is scalenus anterior, and the part of the arrow on the back side towards the spine is scalenus posterior. Okay, let's see what else. Okay, then it gets a little tricky because you see the the muscle between the ribs is just called the intercostals. You only have to know the external intercostal. You don't have to know the internal. You just have to know external.
Ribs, right?
Yeah, intercostal means ribs, so inter means between the ribs. So if I put a pin between 2 ribs, it's the intercostal muscle. And you only have to know external intercostal. I won't ask you the internal. And there's one other muscle that's part of these, and you have to turn it over.
This is still
to
in
see.
the thoracic muscles?
Yeah, these
Okay.
are called deep thoracic group. Okay, so I'm going to turn them over. The muscle in here, right, here's the subscapularis. Here's the splenius. This flap in here Between the two is called the levator scapulae.
But don't confuse that with the levator scapulae ventralis.
Yeah, levator scapulae ventralis is the superficial muscle on the back. This is a deep muscle between the subscapularis and the splenius. It's called the levator scapulae. Okay, so those are the thoracic muscles. Let me do the abdominal muscles. Turn them around again. All right. Okay, so the band that goes like this, right? This is called the rectus abdominis. Goes straight up and down the abdomen.
Where does it end, though? Like, where is it?
Probably here. I put pins all along the length.
Because this is part of the thoracic.
Yeah, these are thoracic.
Okay.
So it's called the rectus abdominis. Down more on the side of the belly, you have the external oblique. It's not clear here, but the fibers are usually sort of diagonal. And then you have the 3 layers of the abdominal wall. Okay, the outermost layer is called the external oblique. Let's see if I can peel the 3 layers. The middle layer here is called the internal oblique. And then the innermost layer, closest to the organs, is called the transversus abdominis. And once you cut through that layer, you're in the abdominal cavity. So there are 3 layers of the abdominal wall. The most superficial is the external oblique. The middle layer is the internal oblique, and then the innermost layer closest to the organs is called the transversus abdominis.
What was this one called again?
The external oblique is the outermost layer.
That's the external. Okay. Wait, but I thought that was the latissimus.
Oh, the latissimus is over more to the side,
Okay.
right? Because the oblique is on the, more
on
the belly.
Okay,
Yeah.
fine. So that's the oblique, and that would be the latissimus.
Latissimus is more on the back side of the back.
Got it.
Or you want to do the neck muscles? It's the digastric on the underside of the chin.
That.
Remember?
Oh, you said gastric means split.
belly. Belly.
Oh, I thought you said it splits into 2 or something.
Well, it has
Oh.
2 bellies, 2 heads.
Oh, okay.
So this is the digastric. And then in between the 2 heads of the digastric of the mylohyoid, it has like a triangle shape. This band here, going from the sternum to the hyoid bone, is the sternohyoid. Now on the side, you have two loops. The bigger loop going from the sternum to the thyroid cartilage of the larynx is the sternothyroid. And then the little loop going from the thyroid cartilage of the larynx to the hyoid bone is the thyrohyoid. So you have the sternothyroid, and the little loop is the thyrohyoid. Then on the V-shaped muscle on the neck, right, you see the jugular vein. Medial to the jugular vein is the sternomastoid. And then lateral to that, more on the side of the neck, is the cleidomastoid. Okay, so those are all on the midterm. And then you also have the cheek muscle, the masseter. All right, you can see here the masseter, the muscle on the cheek. And then the muscle behind the ear, up here, is the temporalis. It's on the temporal bone. So you have the temporalis, and then you have the masseter on the cheek. And those are the muscles of the neck and head.
Awesome.
Thank you.